Good afternoon. I just want to thank you all for coming and for the continuing concern for Rick as he recovers from Ebola virus disease. As we've released information each day, you've seen that he is steadily improving. We're so appreciative also of the attention and professionalism of the biocontainment unit team here at the Nebraska Medical Center. We've been cared for on every level by the physicians, the nurses, the administrators, everyone at this great institution. Nebraska really should be proud. We really are amazed at how quickly Rick's condition seemed to turn around after he was admitted on Friday. As his friend Kent Brantley said on national TV that very night, we attribute his recovery also to both faith and science. Rick asked me to say that he is humbled and overwhelmed by the words of kindness and support that he has received since his diagnosis with Ebola virus disease. Our old friends from years past, new friends whom he has not met, and a long list of those who've supported our mission work for over 25 years have all joined in a mighty chorus of prayer on his behalf. These prayers have made him know that God is near, and they have sustained him. We thank God for his mercy in preserving Rick's life, and we are also thankful for the research, drug, and excellent supportive medical care that was available because he could be evacuated. Most of all, we hope that what is learned from Rick's and his colleagues' illnesses can open up viable possibilities for the treatment of Ebola in West Africa, where the suffering is now extending far beyond the victims of the virus itself. Rick went to Liberia at the beginning of August because he could see that the Ebola crisis was setting off a domino effect in the Liberian healthcare system. Not only was there inadequate medical care for those with Ebola disease, but patients with common health problems were not getting treatment. His patients with high blood pressure would not be filling their prescriptions. Those with diabetes would not be getting their blood tests. And parents were going to lose their small children to malaria because there was no place where they could get the IV drugs they needed. When Rick arrived at the beginning of August, there was not one box of rubber gloves, of latex gloves, to be purchased in the entire city of Monrovia. So clinics and hospitals really almost had no choice but to close their doors until some protective equipment could be available to them. Rick himself had to go all around the city to hardware stores to find boots with which he could supply his obstetrics and his OR staff so they could be protected in that way when they were doing their work. The first week the hospital opened for obstetrics only, they received a dozen women who had been to multiple hospitals after long and unsuccessful labor, and none were able to get a cesarean section at those places. By the time these women arrived at our hospital, only the mothers' lives could be saved. Rick was really heartbroken. Now, I know I'm speaking a bit long and you have a lot of questions you want to ask, but we want people to understand what is really happening in Liberia. We appreciate all the attention and concern for Rick, but he wants you to share his burden for the people of Liberia and West Africa, to carry it along with him. We appreciate that many have given to our mission and many other organizations to make sure that health workers have protective equipment. But the fight against this crisis is going to take more time and resources. We in America enjoy many benefits from globalization, and we'd like to think that we can isolate ourselves from a situation like this, like the one in Liberia. But every day and every week that we don't do what we can to stop Ebola in West Africa, we are risking the possibility that Ebola will not stay in West Africa. Thank you. So I guess we're going to take some questions, and I mean, I don't really know how to manage this.
I'm Laura McCabe,
Okay.
ABC News.
All right.
As you are aware, and I'd like the doctors to chime in on this as well, but NBC News recently broke the news that Rick received a blood donation from Dr. Brantley. And I guess I'm wondering what that means to you to have him here, and what it meant to your husband, and the doctors if they could address the medical issues surrounding it.
Well, I didn't get to see Kent. He was here before I got here. And it really meant a lot to us that he was willing to give that donation so soon after his own recovery. And I spoke with his wife before it was arranged, and we both marveled at the fact that they had the same blood type. That was just, to us, that was something from the Lord. However, since they're so alike, we often thought that they were. But they can speak to any of the other medical issues.
Yeah.
Yeah. He was blessed. He didn't find out till he was not able to like interact with Kent when he was here, but but he was blessed and you know felt the same way we did when we found out it was a match. It was pretty special. So.
Yeah, this is a form of therapy called convalescent therapy. Convalescent transfusion plasma was taken from a donor who had recovered, therefore presumably had antibodies against the virus that Rick had not yet had time to develop. And 2 separate transfusions were harvested and given with no difficulty whatsoever. So in the absence of proven theories, proven antivirals for Ebola, we thought we wanted to try everything we could, and that worked out very well. The first donor we tested was a mismatch, and we were down to our last shot, so we said, uh-oh, but worked out great.
Yeah, we were blessed. Another question?
Just as a follow-up, I know we've heard talk about experimental treatments. This is not that experimental treatment. There's another experimental treatment being used to treat them?
Yes, there's another experimental treatment that's been given as well, and we've been asked not to release the name for a number of reasons. One is we have no data. Some of our blood tests have been sent to the CDC for analysis, so hopefully in the relatively near future, we'll have some information.
Debbie, I'm curious what it was like for you when you found out Rick had Ebola, and just how did you and your family have kind of held up through this process of not being able to see or, you know, through a
Right.
not being able to see him or interact with him.
So he was in Liberia, and it was Labor Day weekend, Friday night, so that would be the 29th, right? And he, actually, I don't think he told me that night. I think Saturday morning he told me that he had been running a fever and he was worried that he was treating himself for malaria just in case and in hope that that's what it was. But after, and we were texting and talking a little bit, but mostly just messaging one another all weekend, monitoring the fever, discussing, you know, the events of the week, I guess. And we were scared. We were scared what it might be. He spoke to the boys on Monday afternoon while he was waiting to get his test. He couldn't test until Monday morning because you often have a negative if you do it too soon. And so he had to wait until Monday to test, and they came and took his blood. And he, later in the afternoon, he was saying, this has been the longest day of my life, waiting to hear. So he had chills and fever a lot over the weekend, took some Tylenol to try and could at least be comfortable. And especially all weekend, he was making sure he was staying hydrated with homemade oral rehydration serum, or what you call it? Solution, that's the word. And which he's a big fan of when there's, you know, when you've got problems. And that, I think, the doctors felt that really helped him when it came time when he arrived, that his electrolytes were manageable. And so it was scary, but I think that when he went away at the beginning of August, we had already discussed that this could happen. I think I had faced my worst fears when he left, and we were. I was very hopeful, I would say. I think my brother-in-law called it optimistic denial, because they were having survivors at the treatment center in Monrovia. And not that they necessarily really know what the secret is to why some people are surviving and some people are not. But I think I was in a really different place than the Brantleys, where they had already, they had seen almost only one survivor, I think, when Kent had gotten sick. And so I think that I had a little bit of, and I'm maybe a little bit more of an optimist than I should be, I guess. So I was thankful. I was really thankful when the evacuation could happen so quickly. The earlier one took so long that it was it all happened so fast. I think we hardly had time to be too afraid. So
I just wanted to add that Rick has been greatly helpful to us as a physician going through this disease. We don't know much about it, but he's able to now very clearly articulate what symptoms he had, when, and what the timing was. So we're learning not just by watching him and treating him, but also by his descriptions, because he's a physician. So he's helped us back.
He said it was Friday evening, the 29th, was when he first began to have a fever in the, just above 100, I think. And I think it was Sunday when it finally got over what they consider probable for Ebola. I don't know if it's 101.5 or 102, something like that.
Debbie, Christina,
Yes.
Channel 7.
Hi.
Hi. Tell me, what was going through your head? What were you thinking when you finally got to the point where you're realizing that you really couldn't do this?
Well, I guess just being thankful and knowing, I think more than anything, just knowing that this is going to be a platform for him to be able to speak out on behalf of the people who are suffering over there, and who, quite frankly, were ignored for the first 6 weeks that this was going on. And I know that he would hate all this attention, but if he can use it to make sure that that resources are used well in Liberia and in Sierra Leone and Guinea to help lick this thing and build up the healthcare systems so that they're not at risk of this kind of disaster again, that he will do everything he can from here on out to make sure that that's true. Now, he would say, this is not about me. This is about getting the job done. So, does that answer your question? All right.
Chase Bob with the local NBC. Tell me about, you mentioned in your statements about the mission to really bring the medicine to the area. Talk about have you been able to talk about the current state of helping this outbreak in terms of where it's standing?
I'll be honest with you, since this all happened, I'm pretty out of touch with what's going on there. The only thing that I can tell you is that so when Rick got sick, one of the doctors who had taken care of Nancy Wright-Ball and Kent Brantley, he had come to the States, he had rested, and he was ready to go back. And he got on the next plane, I believe, out of there, and arrived before Rick had evacuated, and he, in fact, helped Rick get in the ambulance and get to the plane. So the idea is he picked up where Rick was leaving off, basically, and they were redesigning the intake area of the hospital so that they could especially begin to see pediatric patients and get them on the ward if they needed to be. But they needed a stricter triage system. And so Rick had designed that the week before. I got an email this morning from Dr. John Fankhauser that they were finishing up the construction work on that today. So hopefully by next week they will be able to get that in place. But there's just a whole new set of procedures and ways of doing things that they have to come up with to protect themselves from exposure. So, so that's all I really know at this time.
Do you think he knows how he got it yet?
You know, I knew that question was going to come up, and here's my answer. It was investigated by a team in Liberia. I think a CDC team is investigating exposures and such. I honestly do not have details about what they found out and what they figured out. They do believe, I'll say this, they do believe it happened at the hospital in an emergency situation, but up to this point, no other hospital staff have become sick. So I don't know. So that's all I can offer you on that detail.
Two-part question. First, doctor, the term steadily improving has been used. Is there a chance of a relapse, or is this pretty much it will consistently mean steadily improving until he's cured?
Well, I think we're on new ground here. I would say that given his remarkable improvement over the last few days, I would think a relapse would be less likely. But again, since this is a completely new situation, he is different from the patients at Emory. He's different from any other patient, essentially, in the fact that he's received this investigational drug along with the convalescent sera. So there's really no way to tell, but I can tell you his progress has been remarkable.
And Sacra, if your husband, as a wife, if your husband says he wants to go back, what will you tell him?
I'll probably say the same thing I said when he went the first time, and that is, I know where your heart is. And besides, now he'll have immunity. So, but I'm sure that when he gets his strength back, he's going to be ready to go back. And I think that I will have to allow that. So it's where his heart is. He loves Liberian people. He loves Liberia. He loves taking care of the old people. He loves taking care of the babies. He loves joshing with the young men and the young people. They say that he is a Liberian with white skin. So.
Can you talk about what it was like to be able to communicate with him and see him for the first time coming here to Omaha?
It really, yes, I got choked up doing that because he went into the unit on Monday night, and I talked to him on the phone as he was waiting to enter. They were preparing his bed and such. And Tuesday morning, I think I heard from him by email or text or something, and then I did not hear anything till the next morning. I think the mission had heard that he had had a rough day on Tuesday, but I didn't hear his voice. I didn't get a message all the way through Tuesday, through Wednesday. I think he finally called sometime on Wednesday, and he had about 3 minutes worth of energy to talk. In fact, I was on another call, and he called, and my son answered it, and talked to him for a minute, and then my son said, "Dad says you better hurry." He's not going to have much, not going to be able to talk long. So, and then on Thursday, I heard from him as they were starting to get him ready to suit up for the evacuation, just a text message, and then Dr. Fankhauser called me after he was on the plane. So, those days were really pretty rough they were busy because I had news media outside my door all day, but they were hard to not hear from him. And so those, it was nice that over the weekend we were in good contact, but it was a little scarier after he was sicker, obviously.
Timmy said you got choked up.